What if I told you that the number your doctor calls normal, the number that gets a nod and a smile at your annual checkup, could actually be silently damaging your brain, your heart, and your kidneys right now? And what if I told you this is especially true if you're over 60? I know that sounds alarming, and honestly it should, because today we are going to talk about something that the mainstream medical conversation has been getting wrong for decades, and it is costing people their lives, their independence, and their quality of life every single day. So stay with me, because by the end of this video you are going to understand your blood pressure in a way that most people and even some doctors simply do not. Let's start with a question. When was the last time someone took your blood pressure, looked at the number and said that looks fine? For most people over 60, this happens at almost every doctor's visit. You sit down, the cuff goes on, and if that reading comes back somewhere around 120 over 80 or even 130 over 85, you get a thumbs up and you move on. And that feels reassuring. But here is what nobody is explaining to you in that brief appointment. The definition of normal blood pressure has changed dramatically over the years. The risks are age-dependent in ways that are not being communicated, and what is acceptable at 35 is genuinely dangerous at 65. The threshold that was once considered safe has been revised by major cardiovascular institutions precisely because the evidence showed that people were having strokes and heart attacks at numbers that were previously labelled as fine. So the first thing we need to do is throw out the one-size-fits-all thinking and start understanding what is actually happening inside your body after the age of 60. To really grasp this, you need to understand what blood pressure actually is and why it changes as we age. Blood pressure is simply the force that your blood exerts against the walls of your arteries as your heart pumps it through your body. It is measured in two numbers. The top number, called systolic pressure, measures the pressure when your heart beats and pushes blood out. The bottom number, called diastolic pressure, measures the pressure when your heart is resting between beats. Now, when you are young, your arteries are elastic. They are flexible, almost like rubber bands. They expand when blood rushes through and contract when the heart rests. This elasticity is a natural buffer. It absorbs the force of each heartbeat. But here is where age becomes the enemy. Starting around your 40s and accelerating dramatically in your 60s and beyond, your arterial walls begin to stiffen. This process is called arteriosclerosis, and it is a completely normal part of aging, but normal does not mean harmless. As your arteries lose their flexibility, they can no longer absorb that force as effectively. The result? Your systolic blood pressure rises. Your heart has to work harder to push blood through vessels that have lost their give. And every single time your heart beats about 100,000 times per day, that extra pressure is hammering against the fragile walls of your blood vessels, your brain tissue, your kidneys, and your heart muscle. Now here is where the normal is killing you conversation really begins. The old guideline for many years was that a systolic pressure of up to 140 was considered acceptable, especially in older adults. Some physicians even use the informal rule of 100 plus your age, which would put an acceptable systolic number for a 65-year-old at 165. I want you to really sit with that for a moment, because that number 165 systolic would today be classified as stage 2 hypertension. And study after study has shown that maintaining blood pressure at that level dramatically increases your risk of stroke, heart failure, and kidney disease. In 2017, the American College of Cardiology and the American Heart Association updated their guidelines to define high blood pressure as anything above 130 over 80. That single change reclassified nearly half of all American adults as hypertensive overnight. Half. And the majority of those newly classified people were over the age of 60. The science had finally caught up with what was happening inside people's bodies, and what it revealed was not pretty. Let's talk about what elevated blood pressure is actually doing to your body over time, because this is not abstract. This is physical destruction occurring silently, without pain, without obvious warning signs, which is precisely why hypertension earned the nickname the silent killer. Your brain is perhaps the most vulnerable organ. The tiny blood vessels in the brain are extraordinarily delicate. When blood pressure is chronically elevated, these vessels weaken and can either burst, causing a hemorrhagic stroke, or they can become so damaged and narrowed that blood flow is reduced, leading to what doctors call white matter lesions, or small silent strokes that you may never even feel but that accumulate over years and lead to cognitive decline, memory loss, and eventually vascular dementia. Research published in major neurology journals has consistently found that people who maintain elevated blood pressure in their 60s have significantly higher rates of dementia in their 70s and 80s. The brain you have at 80 is being shaped by the blood pressure you tolerate at 62. That is not a metaphor, that is biology. Your heart is working overtime in ways that lead to its own destruction. When the heart must constantly pump against high resistance, the muscle walls of the left ventricle, the main pumping chamber, begin to thicken. This is called left ventricular hypertrophy, and it is a serious red flag. A thickened heart muscle is a less efficient heart muscle. It becomes stiffer, it requires more oxygen, and it is far more prone to arrhythmias and heart failure. Heart failure does not mean your heart stops. It means your heart is no longer able to pump blood efficiently enough to meet your body's needs. You start experiencing fatigue, fluid retention, shortness of breath with minimal activity, and a dramatic reduction in your quality of life. And this process begins at blood pressure levels that many doctors are still calling borderline or something to watch. Your kidneys are the third major casualty of uncontrolled blood pressure, and this one tends to get the least attention. Your kidneys contain millions of tiny filtering units called nephrons, and each of those nephrons is fed by a small blood vessel. When blood pressure is chronically elevated, it damages these vessels and reduces the kidney's ability to filter waste from your blood. The kidneys then compensate by retaining more sodium and water, which in turn raises blood pressure even further, creating a vicious cycle that accelerates kidney damage. Chronic kidney disease affects a significant portion of adults over 60, and hypertension is one of its leading causes. And here is the cruel irony. As kidney function declines, it becomes increasingly difficult to control blood pressure through lifestyle changes alone, meaning early intervention is infinitely more valuable than late-stage management. So what are the numbers you should actually be aiming for after 60? This is where I want you to pay very close attention, because the current evidence-based guidelines recommend that most adults, including those over 60, should aim for a blood pressure below 130/80. Some research, including the landmark SPRINT trial published in the New England Journal of Medicine, found that targeting a systolic pressure below 120 in adults over 50 with elevated cardiovascular risk significantly reduced heart attacks, strokes, and death from cardiovascular causes compared to the standard target of below 140. Now, this does not mean that your goal should be to get your blood pressure as low as possible. Very low blood pressure, hypertension, carries its own risks in older adults, including dizziness, falls, and fainting. The sweet spot, the range that your doctor and you should be working toward, is generally between 110 and 130 for systolic pressure and below 80 for diastolic. But this must always be individualized based on your overall health, your kidney function, any medications you are taking, and your risk of falls. Now let's talk about what you can actually do, because information without action is just anxiety. The good news, and there is genuinely good news here, is that blood pressure is one of the most modifiable risk factors in medicine. Even in your 60s, 70s and beyond, the changes you make today can meaningfully lower your numbers and reduce your risk of serious events. The first and most powerful lever you have is dietary sodium reduction. The average adult consumes far more sodium than the recommended 1,500 to 2,300 milligrams per day. Sodium causes your body to retain water, which increases blood volume, which directly raises blood pressure. The biggest sources of dietary sodium are not the salt shaker on your table. They are processed foods, canned soups, bread, deli meats, and restaurant meals. Simply shifting toward a whole food diet and reading nutrition labels can reduce your sodium intake dramatically. And studies show this alone can lower systolic pressure by 5 to 10 points in many people. The DASH diet, which stands for Dietary Approaches to Stop Hypertension, was specifically designed to address elevated blood pressure and has decades of clinical evidence behind it. It emphasizes fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while limiting saturated fat and sodium. People who follow the DASH diet closely have seen reductions in systolic blood pressure of 8 to 14 points, comparable to some medications. Particular foods have been shown to have specific blood pressure lowering effects. Beets and beet juice are high in nitrates, which the body converts to nitric oxide, a compound that relaxes and widens blood vessels. Leafy greens like spinach and kale are rich in potassium, which helps the kidneys excrete sodium. Berries contain compounds called flavonoids that improve arterial flexibility. Garlic has been used for centuries as a cardiovascular agent, and modern research supports its ability to modestly but meaningfully lower blood pressure. Oily fish like salmon and mackerel provide omega-3 fatty acids that reduce inflammation in arterial walls. Physical activity is the next non-negotiable intervention, and I want to address the misconception that exercise raises blood pressure and is therefore dangerous for people who already have high readings. Acute exercise does temporarily raise blood pressure during the activity itself that is normal and healthy, but regular moderate aerobic exercise over weeks and months lowers your resting blood pressure through several mechanisms. It strengthens the heart so it pumps more efficiently, it improves the elasticity of blood vessels, it helps with weight management, and it reduces the stress hormones that contribute to elevated pressure. The recommendation for most adults with hypertension is at least 150 minutes per week of moderate intensity aerobic activity. Think brisk walking, swimming, cycling, or water aerobics. Resistance training 2 to 3 times per week adds additional cardiovascular benefits. If you have been sedentary, start slow and build gradually, and always consult your physician if you have significant cardiovascular disease before beginning a new exercise program. Stress management is perhaps the most underestimated tool in blood pressure control. When you are under chronic stress, your body releases cortisol and adrenaline, which cause your heart to beat faster and your blood vessels to constrict. For many people over 60, life brings genuine and sustained stresses, caregiving responsibilities, financial concerns, grief, social isolation. These are not trivial, and their cardiovascular impact is real. Practices like mindfulness meditation, deep diaphragmatic breathing, Tai Chi, and yoga have all demonstrated measurable reductions in blood pressure in clinical studies. Even 10 minutes of slow, controlled breathing daily can activate the parasympathetic nervous system and bring blood pressure down meaningfully. Sleep is intimately connected to blood pressure as well. People who regularly get fewer than 6 hours of sleep per night have significantly higher rates of hypertension. During deep sleep, blood pressure naturally dips, a phenomenon called nocturnal dipping. When sleep is disrupted or inadequate, this dipping does not occur, and the cardiovascular system never fully recovers from the day's demands. If you have been told you snore heavily, or if you wake frequently during the night, please talk to your doctor about being evaluated for sleep apnea, which is a major and often undiagnosed cause of resistant hypertension in older adults. Regarding medications, I want to be clear. If your doctor has prescribed blood pressure medication, this is not a failure or a weakness. For many people over 60, especially those with significant cardiovascular risk factors, lifestyle changes alone are not sufficient to reach safe targets, and medication is a powerful, life-saving tool. The key is to not use medication as a substitute for lifestyle change, but rather as a complement to it. Thiazide diuretics, ACE inhibitors, angiotensin receptor blockers, and calcium channel blockers are all commonly used classes of antihypertensive medication, and your doctor will choose based on your individual health profile. So what I would encourage you to do is monitor your own blood pressure at home with a validated cuff device, keep a log, and share those readings with your doctor. Home readings are often more accurate and more representative of your true blood pressure than a single measurement in a clinic, where many people experience what is called white coat hypertension, elevated readings caused by the stress of the medical environment itself. One last critical point that is specific to people over 60, be cautious about the other extreme. As I mentioned earlier, blood pressure that is too low in older adults is also dangerous. If you are on multiple blood pressure medications, or if your blood pressure has been significantly reduced and you begin to experience dizziness when standing up, a condition called orthostatic hypotension, please report this to your doctor immediately. Orthostatic hypotension is a leading cause of falls in older adults, and falls are one of the leading causes of death and disability in the over 60 population. Managing blood pressure in older adults is truly a balancing act, and it requires regular monitoring and communication with your healthcare provider. Here is what it all comes down to. After 60, your blood pressure is not just a number on a cuff. It is a window into the health of every major organ in your body. The standard of good enough is no longer good enough. A systolic pressure of 135 that gets a casual pass at your checkup is, according to the best available evidence, silently increasing your risk of stroke, dementia, heart failure, and kidney disease every single day. It remains elevated. The targets have changed, the science has spoken, and now you have the knowledge to advocate for yourself. Reduce your sodium, embrace the DASH diet, move your body regularly, manage your stress, sleep deeply, take your medications if prescribed, and monitor your numbers at home. These are not suggestions, they are the evidence-based actions that can add years to your life and life to your years. If you found this information valuable, please make sure to subscribe to this channel so you never miss a video like this one. Give this video a like so it can reach more people who need to hear this, and drop a comment below telling me what health topic you want us to cover next. I read every single one, and your suggestions directly shape what we create. Your health is worth fighting for, and it starts with being informed.